The majority of hypertension cases are categorized as hypertension. A. Secondary. B. Primary essential. What do I need to bring with me when I visit? A. Photo ID. B. Insurance card if applicable. C. Current medications if applicable. D. All of the above. Which kind of antibiotics must be avoided while treating patients who are pregnant? A. Fluoroquinolones. B. Beta-lactams. C. Penicillins. D. Cephalosporins. Which of the following insurances do we not need to run insurance eligibility for on Dr. Chrono? A. Medicare. B. Auto insurance. C. Workers' comp. D. All of the above. You have to contact the billing department to send medical records to the patient's primary care physician. A. True. B. False. We accept Medicare Part A. A. True. B. False. What is required for a patient with traveler's insurance? A. A form with the authorization to treat. B. CC incorrectly. C. Form of identification, passport or DL. D. All of the above. How much are AUC school physicals? A. $200. B. $45. C. $100. D. $300. What do we need from every patient? A. Credit debit card. B. Driver's license or a form of identification. C. Health insurance card. D. All of the above. Which of the following are required steps when there is workers' compensation? A. Notify an ops manager on duty. B. Call the patient's employer, get approved modified work duties. C. All of the above. We can accept TRICARE without their physical insurance cards if they provide us with their driver's license and primary subscriber's social security number. A. True. B. False. Follow-up appointments are free. A. True. B. False. When running eligibility on PPO, Dr. Chrono states error in running eligibility. What should you do? A. Double-check all insurance information is entered correctly. B. CC incolliquity and bill to the insurance first if it is active insurance and there is no copay listed on the front of the card. C. All of the above. We can waive the unmet deductible fee if the patient does not want to pay. A. True. B. False. What do we do if urgent care is stated to be non-covered? A. Inform patient the urgent care is not covered. B. self-pay. C. Put CC on file and inform patient we will bill their insurance. D. Inform patient we are out of network. When a patient cancels an appointment or walks out, I have to fill out the cancellation survey. A. True. B. False. How much is the AHC self-pay fee? A. $225. B. $100. C. $75. D. $200. How much is the AUC deductible fee? A. $225. B. $200. C. $75. D. $150. What is our 10-day rule for recollecting unmet deductibles? A. We do not recollect $225 within 10 days for same chief complaint. B. We inform the patient we are not charging them $225 for the second visit. C. We collect $225 for every visit if there is an unmet deductible. Cash payments are to be manually inputted and allocated in Dr. Chrono. A. True. B. False. A patient has an outstanding balance, not in collections, and can't afford to pay it today. It is okay to see the patient and bill them later. A. True. B. False. You run eligibility and it states out of plan network for all of deductible, copay, and coinsurance. What is the protocol for this situation? A. Collect CC on file, informed that we will bill their insurance first, and see patient today. B. Charge an extra fee since the insurance is not in network with us. A regular health insurance patient is given an orthopedic supply. Which of the following statement is true? A. Inform the patient that an orthopedic supply is covered by insurance. B. Receptionist MA informs patient that patient has pay out of pocket for the supply and charge accordingly to self-pay schedule. What is the insurance name and payer ID for Medicare? A. 36273 AARP Supplement. B. 87726 AARP Complete. C. PRNT 1824 Medicare. D. SMCA1CA Medicare Part B North. After running eligibility for a patient, this is what is shown. Deductible states out of plan network. Copay states not applicable for plan network. Coinsurance states 40% in plan network. Which of the following would we look at based on the information? A. Coinsurance. B. Deductible. How much are TB skin test if the patient does self-pay? A. $100. B. $200. C. $50. D. Free because insurance covers test. You have a patient come in with VA, Veterans Affairs insurance. Select the items that are required for patient to be seen. A. Driver's license. B. CC incorrectly. C. All of the above. A patient comes into your clinic with Aetna insurance. Eligibility gives you an error and it is the weekend. The front of the card states Urgent Care $50. You collect the $50 copay based off the front of the insurance card. A. True. B. False. Which of the following is the correct order to verify eligibility? A. Out-of-pocket, stop-loss, deductible, copay, coinsurance. B. Copay, deductible, out-of-pocket, stop-loss, coinsurance. C. Deductible, out-of-pocket, stop-loss, coinsurance, copay. In what order do we input a cash payment into Dr. Chrono? A. Balance tab, Patients Payments tab, add, email Liana and CC Ops Manager. B. Email Liana, Patient Payments tab, Balance tab, add, Payment Method, Cash. C. Add, Balance tab, Payment Method, Cash. At AHC, how much is an intermediate visit that has a consultation and rapid strep test? A. $100. B. $130. C. $150. D. $75. At AUC, how much is a consultation plus X-ray? A. $400. B. $100. C. $200. D. $300. We accept HMO insurance without prior authorization. A. True. B. False. We can make an appointment for a patient at AHC during the nurse's lunch break. A. True. B. False. What is the insurance name and payer ID for Anthem Blue Cross PPO? A. PRNT 1214 Anthem Blue Cross. B. 94036 Anthem Blue Cross. C. 47198 CA Anthem Blue Cross. D. 94036 Blue Shield of CA, Blue Card. How much are sports physicals? A. $100. B. $45. C. $75. D. Insurance covers it. You run insurance eligibility and it states, not applicable for deductible, in plan network for copay, and not applicable for coinsurance. What do you collect? A. Copay. B. Coinsurance. C. Deductible. What is the protocol for a patient that has the flag in collections? A. Call Ops Manager on duty to confirm in collections amount. B. Accept 100% of balance and any additional visit fees due that day. C. All of the above. We accept Stanford Healthcare Alliance and Stanford Healthcare Advantage without prior authorization even if it states HMO on the card. A. True. B. false. You run insurance eligibility. Eligibility states deductible is in-plan network and has a remaining $870.19, copay is out-of-plan network $35, and coinsurance is in-plan network 10%. What do we collect? A. Coinsurance. B. Deductible. C. Out-of-plan network. If a patient is self-pay, what is the payment profile changed to? A. Cash. B. Insurance. C. Check. D. Credit card. A patient walks into clinic and had just been in a motor vehicle accident. She states she is going to use her auto insurance. Her auto insurance has medical coverage. What must be collected from this patient before she can be seen? A. Claim and policy number. B. Insurance company name and phone hashtag. C. All of the above. For no-show cancellation, we change the appointment status to no-show, input the cancellation CPT code under custom codes, then document in appointment notes. A. True. B. False. What of the following actions do we take with HealthNet Insurance? A. Check HealthNet website for eligibility. B. Collect self-pay fee. C. Obtain prior authorization. D. Call insurance. How much is the cancellation and no-show fee for ultrasounds? A. $50. B. $200. C. $100. D. No fee. If family deductible or individual deductible states $0 in-plan network, then we move to copay and do not need to collect a deductible fee. A. True. B. False. If a patient met their out-of-pocket stop-loss, then we do not need to collect their deductible, copay, or coinsurance. We can bill the insurance first. A. True. B. False. AHC can see patients 3 months old and up. A. True. B. False. If you run across an insurance we do not see often, and Dr. Chrono won't let you run eligibility, then what should you do? A. CC in colloquy. B. Enter payer ID and claim information based on the back of insurance card. C. All of the above. We can offer the patient to pay 50% of their outstanding statement balance, not in collections, as long as the balance is less than 30 days old. A. True. B. False. I can email a patient's lab results or tell them over the phone if they request. A. True. B. False. A patient comes into the clinic very upset because of a bill and demands to speak to a manager or billing department. What will you do? A. Give the patient our billings department number. B. Inform your manager and let the patient know someone will reach out to them soon. C. All of the above. A patient calls and asks if there is a provider on site at the AHC clinic. How would you respond? A. Inform patient there is no provider on site. B. Tell patient they will be seen by a provider virtually. C. We work like a hospital. The nurse do all the hands-on work and we select the appropriate doctor to consult you on your condition. Which one of the following should not be used when helping a person suffering from heat stroke? A. A cold alcoholic or caffeine beverage. B. A damp sheet. C. A fan. D. A tub filled with cool water.